Okay, our guest speaker today is Dr. Harry Rossiter. He's Associate Professor of Medicine, Division of Respiratory Care and Critical Care Physiology and Medicine from the David Geffen School of Medicine at UCLA. He also is associated with LA Biomed Research Institute at Harvard UCLA Medical Center, Rehabilitation Clinical Trials Center. So if you know Dr. Cassaberry and his group, he's with us, so we're very lucky, in Torrance, California. So we are honored to have him here today. His topic is fatigue and COPD, staying active and active for a healthy living. So welcome. Thank you for being here today.
Thank you. Thank you, Jackie.
Kind of hold it up pretty high, but I can.
You guys will have to let me know if I forget, drop it down. You let me know. I really want to thank you enormously, Jackie, and Betsy for inviting me. It's a real honor. You guys are the pioneers. This is where pulmonary rehab started. And this is why I made the long journey from the UK to come and work with Dr. Cassaberry in LA Biomed. So today I want to do a little bit of popular science. I want to talk about excuse me. I want to talk about why our bodies crave oxygen. Wonderful. What did I do?
Dan did something.
My fault. Dan did something.
On-off button.
Okay. So I want to talk about oxygen, but before I start on the journey of oxygen, I want to introduce this chap. Does anyone know who this is? It does look like Sir Francis Drake, I agree. He was an explorer, but not in that way. This is William Harvey, and this is his book from 1628, De Motu Cordis, of the heart and blood. He discovered circulation. Before William Harvey, people thought that oxygen went into our lungs and flowed around tubes in our bodies. William Harvey found out that it was the blood that carried the oxygen. I was very fortunate. I grew up in England. My parents are actually American, but I grew up in England. And I went to school here, and this is the biology lab where I was trained, and where William Harvey was trained.
Wow.
William Harvey then went to Cambridge. This is his college, and where I grew up is about 4 miles in that direction. So this is where I come from. Isn't it beautiful? What am I doing here? Well, what am I doing here is this. I don't know how many of you have been to LA Biomed and seen our new research facility, the CDCRC building. I came here to join an incredible team of COPD researchers who work in this building. I kind of like this picture. This was a webcam that was set up by LA Biomed whilst the building was being built, so people could watch it getting built. Your tax dollars, by the way, built this building. NIH paid for it. And this photograph was taken by my mother sitting in England on her iPad, took this picture, but she didn't know that that's me and that's my wife. How crazy is that? It's such a small world. What a fantastic invention the internet has been. So this is why I came. You guys recognize this man, I think, Dr. Cassaberry, and if you haven't met Janos Porzas, you really should come down and have a lung function test and meet Dr. Porzas. Mary Burns took this picture of us in our new building that her camera didn't pick up what we were thinking about. This is what we do. COPD, exercise, muscle, oxygen. This is what we're interested in. And we're doing our research to try and help you guys feel better on a daily basis, be more active, and overcome overcome the difficulties that you face with your disease. So I've got a few things to talk about today. A little bit of it is going to be about physical inactivity and why our bodies crave physical activity. And then I'll talk about some specific data in relation to COPD and talk about some new studies that we're doing in the CDCRC building at LA Biomed. So why is inactivity so bad for us? There was a fantastic research study done in 1968 in Dallas. It's become so famous, it's just called the Dallas study, where what they did is they took 5 individuals, 5 healthy 30-year-olds, and they put them in total bed rest for 3 weeks. Otherwise completely healthy, they just made them lie down. They were only allowed to get up to go to the toilet for once per day. That's all they were allowed to do. Yeah, if they had to go again, they had to stay lying down. And they measured their fitness over that 3 weeks. And over that 3 weeks, their fitness declined 30%. Okay? So if you're a totally healthy 30-year-old and you just lie down, this is what happens to you. Why is that important? Well, it doesn't matter what disease you have, whether you've got high blood pressure, COPD, diabetes, you're just a smoker without disease, you're obese, or you have high cholesterol. If you're unfit, you have a higher risk of death. So these grey bars here are the least fit proportion of all those diseases. These black bars are the most fit. And you can see if you've got high blood pressure, you're twice as likely to die if you're unfit than if you're fit. If you've got COPD, you're about 2/3 as likely. So on and so forth. It doesn't matter whether you're a COPD patient or any other kind of person. Being physically inactive and being unfit is bad for your health. In fact, the Centers of Disease Control in the US describe physical inactivity as an actual cause of disease. Okay? So this is disease over and above what you already have. You don't want that. So the other interesting thing about this Dallas study is the same 5 people came back and were measured again after 30 years. So when they were 60 years old, they came back and had their fitness measured. What do you notice from this graph? Well, their fitness is not very different from after bed rest to 30 years later. What does that mean? 3 weeks of bed rest is equivalent to 30 years of aging for your physical activity and your health. Okay? Now I know you guys find it really difficult to be physically active. That's the main problem that you have. You get short of breath. So we've got to find ways to help you be more active and combat this problem. So why is physical inactivity so bad for us? You would have thought that our genes would have developed a resistance to this. Well, physical inactivity really only came about quite recently with the Industrial Revolution. And if you think about where we all came from, our genes were developed many, many years ago. Does anyone have any idea what this picture is representing?
Chromosome.
What does it look like? Chromosome? Maybe. Red corpuscle? Yeah, okay. Maybe. Any other ideas? No? Okay. Clueless. Not clueless. Good ideas. So this picture is a picture of a mitochondrion. It looks very much like a bacteria. Bacteria we think is bad for us, right? This is a very, very special part of your body, part of every animal's body. They're in all our cells, and what they do is they turn food and oxygen into energy. They used to be, before humans even existed, they used to be bacteria in the soup, in the sea. And for many millennia, as the planet developed, there was very, very low oxygen. This is millions of years before today. This is the percentage of oxygen in the atmosphere. For years and years, there was no oxygen in the atmosphere of the Earth. Okay? And what happened very slowly is that plants started to grow, and plants take in carbon dioxide and produce oxygen, as you know. That oxygen is very reactive. It's actually the reason why it's so valuable to us is because it holds a lot of energy. It's very reactive chemical, and that oxygen reacted with all the chemicals in the sea and the land, and created essentially a lot of oxides. It basically rusted everything for years and years, and it was stored in the rocks. And you can see it doesn't change the concentration of oxygen in the atmosphere for a long, long time until this point, until all that storage finished, and all of a sudden these plants producing oxygen really bloomed. And the percentage of oxygen in the atmosphere started to massively increase. At some point, oxygen gets very toxic. It's a really reactive chemical. Who's heard of reactive oxygen species or antioxidants? Right? You guys have all heard of antioxidants. And you know you're meant to eat more of them. And maybe they're in red berries and things like that, right? Red wine. Well, that's all true. Well, why do you need antioxidants? You need antioxidants because your body is reacting, it's rusting, if you like, to the oxygen in the atmosphere. And that's a very dangerous process. It damages your membranes, it damages your DNA, and actually people think it causes aging. So if we can have more antioxidants in our diet, we can slow the aging process. So as oxygen developed in the atmosphere, it became very toxic, and at some point it killed off a lot of the animal life on the planet. And it's been wobbling around ever since until it came to a balance at around 21%. And that's what we have today in the atmosphere, and that's what, I was going to say that's what you're all breathing, but some of you are breathing extra, which is a good thing. And so our bodies have developed over many, many millennia to live in this oxygen-rich environment, and the mitochondria are there to make sure that those chemical bonds that release energy when we burn oxygen do so in a very, very controlled way. So the first thing we have to do is get oxygen into the body, right? So that's what the ventilation is for, and that's what this beautiful cast of a human lung is showing you. Here's the airways here going out to all the alveoli at the end of the airways where the oxygen is exchanged. This is an electron micrograph, a very, very, very high resolution microscope image of an alveolus. So you can see this kind of bowl in here, the scoop out. That's the end of your airway. These guys right here, that's a single red blood cell, that little donut thing in there. And they're running through the capillaries in your lungs. Isn't that an incredible picture? So the oxygen gets breathed in, and it comes into this alveolus, this bowl at the end of your of the airway, and it has to diffuse through this tiny little membrane. The reason why that membrane is so thin, if you take 300 of those, and stack them on top of each other, they'll be the thickness of a piece of paper. The reason why that is so thin is because oxygen doesn't diffuse very well. It doesn't get into the body very well. It's difficult to get it in, right? So this distance has to be really small so the oxygen can jump from the air into the blood. And unfortunately, one of the things that smoking does, or if you're an alpha-1 patient, or if you're exposed to environmental hazard, it really chews up these very, very thin membranes. So once the oxygen is into the blood, here, we have to deliver it to the tissues. And here's a... why is that not going? Here we go. Here's a... if I can get it to run. Here's a movie of these... You see this little highway here? That's a blood vessel. These are muscle fibers running this way. All these little capillaries here, and that flickering is those little red blood cells running through your muscles. Okay? And this is what we want to see. We want to see all these capillaries nice and flowing and running like this. Physically inactive people, all those capillaries are slow and sluggish, and they don't flow very well. And so it's very difficult for you to get the oxygen down to where you need it in the tissues, to those mitochondria that are giving you the life-giving energy. So what do mitochondria look like in muscles? So this is another electron micrograph. This is a microscope slide. It's been artificially colored. It doesn't usually look this color, but they normally come out black and white. So it's hard to see otherwise. But these are muscle fibers running this way now, okay? Coming up this way. And we chop one open, and you can see these little purple guys on here. Those are the mitochondria right under the surface of the muscle fiber, screaming out, I need that oxygen. I need that oxygen to make energy for the cell. So here's another way of looking at it. This is a red blood cell right here. Oh, actually, I'll tell you what, I think I colored this one. That's easier. Okay, see this nice big red blood cell right here? That's a red blood cell. This is a capillary membrane. And the oxygen carried in these red blood cells has to diffuse across to these brown guys. These brown guys are the mitochondria. Okay, so what your circulation is doing, and what William Harvey discovered, is that the red blood cells bring that oxygen down right close to the mitochondria, and then the oxygen has to diffuse into the mitochondria where it can be used to make biological energy. In muscle, you can then use that for muscle contraction. The waste product of that reaction is carbon dioxide, right there, which has to diffuse back out to the red blood cell, which is now blue, because it's unloaded its oxygen, right? You know, you go cyanotic when you haven't got enough oxygen. The color of your blood actually changes. That's how a pulse oximeter works, measures the color in your blood from red to purple. So when the oxygen unloads, the red blood cell changes to purple. It loads up the carbon dioxide, and it can take that back to your lung for you to breathe out. Okay? Now, why do I care about all this, Harry? Well, the reason why I want you to care about it is these mitochondria, these guys right here, need physical activity in order to express the right genes to promote health. When those mitochondria were incorporated into our cells many millennia ago, we were hunter-gatherers. We were out there on the landscape chasing after tigers or something like that with a spear, right? And physical activity was part of our normal environment. So our genes were shaped with physical activity as part of our normal environment. And since the Industrial Revolution, we've taken that physical activity away. And what happens now is that those genes that are expecting to be exposed to lots of energy turnover, lots of energy production, don't get exposed to that anymore. So what happens... Oh, actually, I wanted to ask you guys a question. Do any of you have any idea how many... Do you have any idea how many calories you're meant to eat per day? Roughly? 3,500. He wishes. 2,500 for a guy. 2,000 for a woman, maybe, depending on your size. 1,200 is even better if you can manage it. Okay, so the average person needs about 2,000 calories per day in energy supply. Do you know how many calories you use, or, sorry, not you, a person would use if they were to run a marathon? Many, many, I heard. Is it more or less than 2,000? More. Everyone's so confident of that. It's actually less. Running a marathon does not take a lot of energy. Why are they so fit? Why are they so skinny? Because it's not the energy you burn during the running that's important. It's the energy you burn during the recovery from the running that's important. And what happens when you recover from physical activity is your mitochondria switch from burning sugar to burning fat. Okay? So after 40 minutes of physical activity, your mitochondria burn more fat. They suck more fat out of the blood into the mitochondria to make energy for 4 to 8 hours after doing 40 minutes of exercise. 40 minutes of exercise will increase your fat metabolism for many hours afterwards. Okay? That's why physical activity is so good for you. Not the energy that you're burning during the activity, it's the energy you're burning after the activity. You're burning fat. So what happens if you're physically inactive and you don't burn that fat? Right? This is a micrograph again. These are the muscle fibers here, and this higgledy-piggledy stuff is the mitochondria, and here's the blood. And you can see this little white globule right here. This is a micrograph of a muscle from somebody who's inactive. Tell me what these great big white lumps are. Fat. Because their mitochondria have never been told, now you've got to consume fat. They're burning sugars. Right? And they crave sugar, and then so you feed their sugar, and so then you get told off by your doctor for having HbA1c that's high. Right? Okay? And you have high triglycerides in your blood because your mitochondria have not been told that they need to burn fat because you haven't done any physical activity. So when you've got all this lipid here, all this fat blocking up your mitochondria, you can see, first of all, you can see there's fewer of them. And secondly, they don't work very well. The oxygen can't get through fat into the mitochondria to be used. Right? And that makes exercise even harder. So you've got this horrible downward cycle, spiral, where you do less activity, you don't want to do any more activity, you do less activity, you don't want to do any more, because it's painful, it's tiring, and it causes breathlessness. So our genes have evolved to want frequent expenditure of energy and then frequent storage of sugar. That's what they've evolved to do. When we're inactive, we have rare expenditure of energy and frequent storage. Then we start storing the fat, and the fat gets in the way of the mitochondria. So our bodies crave a balance of physical activity and inactivity that allows for genes to signal energy expenditure and energy storage in the correct way to maintain your health. So, I want to tell you a little story about Mickey and Minnie. I couldn't think of any good rat names. You know any rat names? These are rats, they're not mice. Okay, so Mickey and Minnie are a breed of rats that have been bred to have lots of mitochondria in their muscles. So the way this was done is exactly like breeding a racehorse or a greyhound. They took a litter of rats and they ran them on the treadmill, and they saw which ones could run a long way and they saw which ones could run the short distance. And they took the ones that were really good at running and they bred them together. And they took the ones that were really bad at running and they bred them together. And they did that for 10 generations. Okay? So what happens after 10 generations of natural selection for high fitness? Okay. So what happens is, well, all these things, all this alphabet soup here is science speak for the mitochondria got about 30 to 40% higher in their muscles. That's the first thing that happened. Their muscles increase the amount of capillaries. Well, this improves the ability of the blood to deliver oxygen to the muscles, so the muscles can get the oxygen. Their muscles actually became stronger. There were a greater number of muscle fibers. This might surprise you, may not, I don't know, well, we'll see. The heart and blood became more healthy. So the amount of insulin went down by 130%. The amount of triglycerides and fats in your blood and cholesterol went down by 100%. The amount of glucose went down, and the blood pressure went down. Now, these are animals that have never been exposed to physical activity in their life. They've just been bred for physical activity. They're inactive in their cages, right? So what it's telling us is that the ability to do physical activity in itself is really, really good for your health. And you might be not surprised then that their exercise capacity was greatly increased, and their ability to sustain constant exercise was increased by 350%. So they could go 3.5 times longer before they came exhausted. The other thing is that they lived 25% longer. There's a question.
The question is related to age. I mean, we're all getting quite a bit older, and when we have the same effect as you see in the lab.
Really good question. Can I hold it for about 2 slides? Because I'm going to come on to that. So the question was, we're all older. Can you still get these effects when you're old as when you're young? So I'll come back to that question in a second. So physical activity in its own right, you're not surprised to know that physical activity reduces cardiovascular disease and stroke, reduces coronary artery disease, diabetes, and high blood pressure by a lot. Those things aren't surprising. They're kind of in the common knowledge, right? You might be surprised to know that physical activity reduces osteoporosis, that's bone disease, that is quite prevalent amongst patients with COPD. It reduces the number of hip fractures. Well, this is unsurprising because your muscles are stronger if you're physically active, right? You might be surprised to know that it reduces cancer. The mitochondria that are involved in physical activity are also involved in providing energy to grow cancer cells. How about dementia? Who thought that being physically active protected against Alzheimer's disease? But it does. And even depression. So essentially what I'm saying is that physical activity is good for your health overall. It doesn't matter what disease you have, being physically active is a good thing. So how about you guys? Your struggle is being physically active. You get breathless. You need to, you come along to, I've lost Jackie and Betsy now, where are they? They come along to these guys and they give you the toolkit to be able to be more physically active and keep your body more healthy. So we've recently done a study, maybe I recognize a few faces here, so maybe some of you have volunteered for this study, where we measured physical activity in COPD patients who were part of the COPD gene study. I don't know how many of you have done this. So what we do is we give you a little portable accelerometer. It's a little device you wear on your back, wear it all day, all night for a week, and it records your movements. And I've broken this graph up into 3 groups. There's a group that have normal spirometry, there's a group with mild lung disease, and there's a group with severe lung disease. And you can see what happens to physical activity. This is everyday movement measured as the number of steps you do per day. You can see what happens in severe disease, and this is not surprising, right? We know that being physically active is difficult for you. Does anyone know how many steps per day we're meant to do to keep our health? 10,000. Right. So I'm not going to admonish these guys because you've got lung disease. It's very difficult for you. But look at these guys. Only 7,000 steps per day. Come on, we need to do more. Right? I don't want these smokers here who don't have lung disease yet to move down more rapidly into these groups. Yeah? 10,000 steps a day is really difficult. I use my iPhone to count the number of steps I do. It stays in my pocket. And there's tons of apps you can download. And you can follow it. And you could use a wrist device. You can use all sorts of things. Count the number of steps. So from those number of steps in these patients, we can calculate how much energy they use. Because we know how much energy it takes to walk for a certain age or weight. So this is the amount of energy expended per day. Here's the 2,500 on average, probably a little bit for the normal patients with normal lungs, down to about 2,000 here on average for the patients with worse lung disease. So this is the amount of energy that the body is expending for physical activity. Look at the slide for the amount of mitochondria in your muscles. Doesn't that look exactly like that, right? The muscles that are not exposed to physical activity lose mitochondria. They lose mitochondria and the mitochondria get unhealthy. And then promotes early aging and promotes disease. So back to Mickey and Minnie here. So how about them? So I told you that by breeding these guys, we could increase the amount of mitochondria in their muscles by about 40%. Right? And I also told you that being inactive for 3 weeks causes the amount of mitochondria in your muscles to go down. Right? So does that mean, it doesn't really matter, Harry, this is all genes. I can't change my genes. Right? This increase is all to do with genetics. Well, look what happens when I take the unfit ones and I put them through a training program. Okay? 8 weeks of exercise training brings them back up, right up to what 10 generations of breeding did. And all those healthy things that went along with it, the lower blood pressure, the better triglycerides, the lower blood sugar, all those good things went with it because the mitochondria are more prevalent and they're using the energy better. So somebody asked me about, can we still do this when we're older? So remember that bed rest study where the people went to bed for 3 weeks? So after they went to bed for 3 weeks, they gave them an exercise rehabilitation program for 8 weeks. So when they were 30, before rehab they started there and they increased their fitness to there. It's about 20% increase. When they were 60, they came and did the same thing. 20% increase. And whilst 3 weeks of bed rest can be equivalent to 30 years of aging, 8 weeks of exercise training can reverse that 30 years of training. I wish it was 3 weeks and 3 weeks. Wouldn't it be better? I'm sorry you have to do 8 weeks of training. But that's what it is. So Jackie and Betsy Jackie and Betsy can help you guys to be more physically active with your pursed breathing, with your diaphragm, finding the right oxygen equipment. We are constantly doing research to try and find out ways that we can help you to be more physically active. But whatever you can do, if it's just a little bit of arm exercise, it's all good. You're spending energy. When you're sitting down, listening to me, metabolizing that great big steak that you just had, you're not expending energy, you're storing it, and we need you to be out there expending it. So, in the last little few minutes, I just wanted to talk about a few new research studies that we're doing over at LA Biomed that you can come and volunteer for if you're interested. So one of the studies that we're doing, we pioneered this new method for measuring the amount of mitochondria in the muscles, and this is what I've been talking about today, is the thing that really imparts that health benefit. So that normally, all those beautiful electron micrograph pictures I showed you, you have to stick a great big needle in your leg and take out a chunk of muscle. Well, we developed a way where you don't have to do that. We just shine a light into your leg, a bit like an oximeter, and we measure the amount of mitochondria in the muscles that way. So starting next month, we're going to be doing a new study looking at the mitochondria in the arms and in the legs. We've looked at the mitochondria in the legs, and we know that they're low in patients with severe disease, probably because they're physically inactive. So we want to know whether their arms are active too. We want to know whether the amount of mitochondria in the arms has gone down. This is a really easy study. Just requires one visit. We'll give you a spirometry, and we do this leg test where we blow up a cuff around the leg, a bit like the blood pressure cuff on the arm, and we shine light into the muscle. Hi.
What is the age limit on that?
That's a good question. I haven't. Probably 85. I have to think about that one. I can't remember off the top of my head. But most of the people who are eligible for COPD gene should be eligible for this. So it's the same age range, and that COPD gene is up to 85.
And it's only for COPD patients.
At the moment, it's only for COPD patients. If you haven't got COPD, if you're a non-smoker, you can do the study too. Another study that we're going to start in later in the year is looking at CO2. I didn't talk much about CO2, but remember that's the byproduct of oxygen metabolism. And that's the thing that you guys have trouble getting rid of because it makes you breathless. So we're doing a study. How many people have had an arterial blood gas measurement? How many people like that? Yes, I know, exactly. They're really painful. I appreciate that. So what we're going to do in this study is use a device that we think can measure CO2 through the skin. Just heats up the skin, and it goes on the ear, and it's non-invasive. No. Yes and no. So there's a rub. In order to prove that it's working correctly, we need to take arterial blood gases. So if you don't want to have an arterial blood gas, this isn't the study for you, right? But if we can prove that this machine works the way it's supposed to work, then maybe we can get rid of arterial blood gas for other people. This machine is often used in the intensive care unit, and it works quite well in that situation. We want to use it during exercise to see whether we can monitor how well you're breathing that CO2 out during exercise. There's a study of pulmonary valves. I didn't talk about this at all, but I think Dr. Katsuburi told you about this a few months ago. We're still running this study for people who have pretty severe emphysema. This is something to think about. It's a serious intervention, but it could be life-changing. What it is that we go in with a bronchoscope and we put these little one-way valves into the airways, and that allows when you breathe in, the valve shuts and you can't breathe into that piece of lung. That's the damaged piece of lung over here. And when you breathe out, the gas in the damaged piece of lung breathes out, and therefore it deflates, and it allows the good part of the lung to inflate better when you're breathing. Okay? So as I say, this is a fairly major study for patients with pretty advanced disease. If you know anyone like that, they might want to come and talk to us. There aren't very many centers in the country doing this, and so there aren't many opportunities to join in, but if you think you might be interested, please get in touch with us. We're doing 2 studies on 2 different anti-inflammatories. One is a pill and one is an injection. Both are designed to do different things. The PI study is aimed at restoring the lung. It's aimed at repairing the lung. So there's this we know that the repair processes in the lung of patients with emphysema are damaged. The lung can't repair itself quickly enough. And so what we're trying to do is boost that repair process. Well, it turns out that ibuprofen or Motrin is a good drug to promote that repair process. So we're trying that. If you've got a good stomach and you can take ibuprofen and you're willing to come in and have a bronchoscopy and you have emphysema, then you might be able to participate in this study. This other study is to prevent flare-ups, to prevent exacerbations. So another part of inflammation, the bad part of inflammation, can get out of control and can put you in hospital. And so if you've had flare-ups in the last year and you're willing to come in and try a new drug that might be beneficial to prevent you going back that way, then take our number down. I'll give you the number at the end. You might be eligible for that, particularly if you're an allergy sufferer. The entry criteria are easier if you suffer from allergies. We've got 2 training studies, one that's currently going and one that's going to start next year. These are new ways of exercise training. We know how difficult it is for you guys to be physically active and get high-intensity activity. So that high-intensity activity is so beneficial for your health. So we've devised a new training program where you do, it's kind of described as riding the hills. You go up and down like this on a bike. If you're interested in doing that and you haven't done rehab recently, maybe we can come and give you a top-up, and you can come and see us in the lab. We can get to talk to the doctors to get a breathing test and try out our new training regime. It's a 4-week study with exercise tests before and after. In the new year, maybe I can come back and tell you about this other method. This is a kind of interesting method that has been used in Japan. It sounds absolutely horrendous. It's called occlusion training. But it's actually been shown to be very, very beneficial. Turns out if you blow up a blood pressure cuff around your leg here when you're doing walking, you can really boost the training benefit by doing much less exercise. So a lot of the problem for you guys is getting the high intensity to get up there, because that's what makes you breathless. Well, this is like doing high intensity training, but doing very low work rates. So we're in the process of getting ethical approval for that, IRB approval, and we will be getting back to you later on to see if anyone wants to try it. Last, let me put a little bit of a plug in for the Pulmonary Education Research Foundation. I think most of you probably know about PERF. We've got a couple of people in the audience, Kurt and Dan and myself are all members of Pulmonary Education Research Foundation, and Mary Burns is the real driving force behind this. We have started a new blog which gives out information once a week, and if you'd like to sign up for that, give us your email address. We'll send you one email a week, and you can put it straight in the trash if you don't like it. But it gives you a little bit of information about new discoveries, new COPD information, about, I think that today's one was about coping with the heat, which is very pertinent. So if you have an email address and you'd like to communicate that way, please give us your information, and then all we'll do is send you this one email a week. So that's about my time. I'd like to thank you for your attention. I think this is the team. I think most of you, or some of you at least, will know Letty here, and Dr. Casaburi, Dr. Stringer, Dr. Porzas here. If you want to participate in any of our studies, or if you're interested in signing up for the PERF email list, you can give me your information, or you can give Letty or Renee a call on the number on the screen. So thank you very much. There are some studies for patients with pulmonary hypertension as well. We don't have any for pulmonary fibrosis. I've got some sign-up sheets. You can. Not very much. I'll pass these around. This is to sign up for the email shop if you're interested. I've got some cards here too that have information about the Pulmonary Education Research Foundation.